The world is changing. Inspiration is everywhere. It has never been so easy to connect, share, and bring people together. We're learning from others and finding the best in ourselves. Challenging our beliefs. Sharing our vulnerability. Overcoming our fears. Transforming ourselves so we can transform the world. How far can we go?
This is London Real. I am Brian Rose. My guest today is...
This is London Real. I am Brian Rose. My guest today is Dr. Judy Mikovits, the molecular biologist, medical researcher, and author. For over 3 decades, you conducted internationally respected research in top government labs with your doctoral thesis revolutionizing the fight against HIV and saving millions of lives. Throughout your career, you have exposed fraud at the highest levels of healthcare, including that of Dr. Anthony Fauci and the current heads of both the National Institutes of Health and the Center for Disease Control. Your new book, the #1 Amazon bestseller, Plague of Corruption, details your experience with Dr. Fauci and outlines his deceit of the American public and the impact on their health. You are featured in the new movie Plandemic, which has gone viral and is being banned on every major technology platform. Dr. Mikovits, welcome to London Real.
Thank you, Brian. I'm delighted to be here.
Great to have you here. First, I wanted to announce that we are streaming now on our brand new Digital Freedom platform, which is a censorship-free independent broadcasting system that is of the people, by the people, for the people, and available exclusively through our website at londonreal.tv. Dr. Mikovits, I pledge to you and everyone watching us that none of this conversation will be edited, censored, removed, or banned, and that anyone in the world can watch the full version of this episode free at londonreal.tv/Mikovits. Thanks to the generous donation of over 25,000 people from around the world that I affectionately call the London Real Army. For anyone wanting to become a founding member of the Digital Freedom platform, they can go to londonreal.tv/freedom to donate and fight with us on the front lines to protect our human rights. Here at London Real, we've been a platform for free speech since 2011. And Dr. Mikovits, I'm excited to have you here today. I wanted to begin by asking you about the coronavirus pandemic response as a whole. You have called it corruption, but most of the public, I think, sees it as an earnest reaction to a deadly virus that's threatening the world. What do you think is really going on?
Well, I really do think it's a plague of corruption, and I think the way the general public can appreciate that is because the measures that have been taken, worldwide, things like masks, staying indoors, closing public restrooms, closing public beaches. These aren't measures. These aren't public health measures that would end of a viral outbreak. And in fact, they could prolong it and make the most vulnerable even more vulnerable, because the healing immunity of the sun, the sea, the sand, exercise, the most vulnerable are protected, in fact, by the healthy who get exposed, develop an appropriate immune response. And we know now that natural, what we call herd immunity, has occurred in places like Sweden, I think like South Korea, places where such draconian measures weren't taken. So the freedom that was taken away to take care of our own health is why I consider this a plague of corruption.
And so you see us doing almost the exact opposite of what we should be doing right now.
Absolutely. Every measure that's been touted by our federal officials here, especially the influenza vaccination recommendations, which now publications clearly show people are more susceptible to infection of coronaviruses if they get the influenza vaccines. And yet here and in Italy, here in the United States and in Italy, to are the places that have been hardest hit. Those vaccines are still, while not mandated, suggested and given, administered to the most vulnerable, the elderly, those who have comorbidities, and that is peer-reviewed, published to be the worst thing to do for a coronavirus.
Yeah, I remember Dr. Birx at one of Trump's conferences saying, that you must get the flu vaccine, immediately to protect against this. And yet I've heard you quoting that they increased the odds by 36% of getting COVID-19. Maybe we'll get into shortly why they would even say something like that. What else? The masks, the social distancing, the lockdown itself, these are all things that are actually going to hurt us in the long run?
Yeah, they have nothing to do with public health. It's immune suppressive. It's horribly stressful. So we see depression, we see anxiety, we see fear in our children, the grandparents who can't see the grandchildren, birthdays that are, friends seeing friends in masks for little children. It's really going to be lasting in the damage of these measures, which really don't protect anything at all. The masks don't protect anyone from getting infected with the virus. The viruses can go through. They can trap toxins. They can exacerbate upper respiratory infections by activating your own virus as you become immune suppressed. The masks are extremely stressful, and the body perceives that by suppressing the immune response rather than enhancing it, which is what sunshine and love and touch does for us.
We actually need to kind of have the touch and the exchange of kind of germs and microviruses with other people anyways. That's a part of being healthy.
Yeah, it's immune boosting. It boosts your immunity. You see it, you respond in such a way. Yes, that's what we know from generations of research. So never have these measures been taken before. And again, this is little more, all the data now support little more than a normal influenza season with respect to death. And the very people who are I think it's 0.1% to 0.3%, all the data shows, of death from the coronavirus infection. Most are asymptomatic, meaning they're just healthy people. They're not asymptomatic carriers. They've cleared the virus. Coronaviruses don't integrate. They don't stay with you. You clear them when you develop immune response. Yes, you can be exposed in another year, but again, you've already got an antibody. You're primed to respond quickly, and likely, unless you're the very ill and have many comorbidities, you will not get very sick at all, and that's what the data support. So those with comorbidities are damaged most by the oxidative stress, we call it, and the stress of the measures that are being taken.
And is it true you're expecting disease to jump once we end the lockdown because people's immune systems have kind of gotten worse in this isolation?
I don't expect disease to jump right now. I believe that because I believe people now realize healthy measures, healthy food, vitamin C, that they're pre-exposure, prophylaxis. There are measures that we can take to prevent. We know about things like the type 1 interferons, like vitamin C, like zinc, the hydroxychloroquine. We know measures that we can keep on the shelf. Glutathione, just giving yourself the capacity, your intracellular antioxidants, and of course, vitamin D and sunshine. So I don't expect disease to jump. That's how we're being, fear is powerful immune suppressive. So everybody being fearful to go out is probably the worst thing. And I don't see that fear. I don't have that fear.
Okay. You've said that there's a massively liberal overdiagnosis of COVID-19 in the U.S. What do you mean by that? And what are the ramifications of that?
Well, correct. I've actually quoted Dr. Birx, who said, we're going to diagnose COVID-19 liberally. That is anyone who has a cough, anyone who has a fever, anyone who has flu-like symptoms, practically anyone who walks in a hospital is going to be diagnosed with COVID-19. And the most important thing with that is not only could there be no evidence of infection at all, but it really doesn't matter, because you don't die with an infection, you die from or of an infection, and clearly you don't write a death certificate to say that someone who is HIV infected, who walks in and has a heart attack, died of AIDS. So you can see we have many viruses. We have a human virome that is 8% of our body. So those are the very viruses you're going to wake up when you get flu injections, when your immune system is suppressed. And so are all of those viruses part of COVID-19, or is it only SARS-CoV-2? So you see, nothing about the normal causation has been satisfied here, that this agent, SARS-CoV-2, causes COVID-19. So there will be a huge deception, really, of the public health, and those with those co-infections and those other injuries will be the first to die, and then the truth will be buried with them as legitimate autopsies don't happen, or even we've been told people won't be allowed in the military if they've been infected in the past. We know of people who have committed suicide because they were infected, they recovered, they developed an immune response, but then they can't go back to their jobs because everybody's afraid of them. This is horrific, and that liberal diagnosis and these really these lies that continue to be perpetrated by public health officials with conflicts, with serious conflicts of interest, and of course, who have done this in the past on several occasions.
And so what is really going on here? I mean, you talk about these people that are standing next to the President of the United States, on a nightly basis. What are they doing? What is the corruption happening? Is this a grand scheme, or did it land in their laps and they're behaving accordingly? Or is it, again, all come down to financial interests? What is happening here?
Well, there's a lot of data to support, that this is a plague of corruption and a cover-up of basically the use of contaminated, mixing animal tissues with humans and human tissues and injecting them in the immune compromise, which is the definition of our vaccines, with no safety testing, a contaminated blood supply with many adventitious agents that are coming out of the laboratories, not just a new SARS-CoV-2, but many strains of cancer-causing retroviruses that come from monkeys, pig, cow blood. All of these things are in our vaccines, and those people who are immune compromised, half of American children have asthma. Those are the people who are susceptible to coronaviruses, COVID-19, to the vaccines that they're driving. We're told we won't be able to go back to our lives ever without mandated vaccines. Those vaccines will kill the vulnerable, though, and then you will cover up 40 years of the plague of corruption, 40 years of vaccine injury, 36 years we haven't had safety testing done on the vaccines used in the United States. And it's really no different in the UK, where we have extensive work over the last decade with ME, with myalgic encephalomyelitis, which there's considerable corruption surrounding that in the UK. And those also are the vulnerable. I've been getting messages from the patients in London saying, oh, here you go again, the reason why people with ME ME got COVID-19 is they're psychosomatically fearing the virus so much that they brought it on themselves. And this is what these diseases have been falsely said to be, not infectious transmissible agents causing ME, autism, cancers, but in fact psychosomatic, people who wished an illness upon themselves. And the NICE guidelines and all the studies that were shown to be fraud over the last decade by people like Sarah Myhill and other doctors who have been viciously attacked, similar to me, as I've experienced in the US. So I very firmly see the evidence that this is a plague of corruption, and those that are injured will be killed, not only by the SARS-CoV-2 if they should be infected, but especially should they receive any kind of vaccine ever again.
And so you think they're actually preventing the therapies until everyone's infected, and then once they're infected, the vaccines will come out and people will die from that, and that will cover up all of the corruption that's gone on in the vaccine industry for the past 40 or 50 years?
Yes, because they'll say they died of COVID-19 and not of the vaccine injury, which is denied, or ME, which is strongly associated with the gamma retroviruses that came from the contaminated blood supply, and the vaccines for the last 30, maybe even 70 years since the first cases in the US in 1934, as we learned that polio, the enteroviruses that cause polio, passed through mouse brains, picked up mouse cancer-causing and neuroimmune disease-causing retroviruses. And then later on, when we cultured these live viral vaccines like MMR, like polio, these RNA viruses, we culture them in animal cells, including the same Vero monkey kidney cells where we get SARS-CoV-2 and SIV, the ancestor of the monkey version of HIV, Mason Pfizer monkey virus, which is a horrible virus of the gamma retrovirus family. And these cause profound immune dysfunction and immune deficiencies. And those are characteristics of the ones that these patients have. And so they will be, the first to die from the vaccine, and especially if the vaccine is given after the infection. And the data are clear about that in every other case of SARS or MERS vaccine development. And so it actually drives the disease and the death.
That is a dark scenario. And I was on a call with Robert Kennedy Jr. this week, and I got a degree from MIT, and I'm familiar with the scientific method. And when he started explaining some of the testing or lack thereof of vaccines, it blew me away. And then when he talked about the lack of liability for these companies, I was again surprised. And then the lack of effectiveness. And I got a 101 course in vaccines and the industry of, and I was appalled. I mean, my jaw was kind of open, because I just assumed it would be tested like any other drug, but it seems like it's not. And also, he went ahead to say, look, Brian, I'm not anti-vaccine. Just like when I'm fighting against mercury in the ocean, I'm not anti-fish. You've said you are not anti-vaccine. Maybe you can comment on some of my observations.
Yeah, absolutely not. I'm not anti-vaccine. And since 1980, when I developed and was part of the team that used the first immune therapy, that was interferon alpha, type 1 interferon, as a treatment for infection-associated cancers and leukemias, that's the definition of vaccine. So for the rest of my career, I've believed and I've made drugs and therapies based on the idea that you can educate the immune system to prevent or treat infectious disease or cancer. That's the definition of a vaccine. So what I'm against is the fact that in all of those immune therapies that I've developed, all of those natural product-based therapies that we've developed over my career of 40 years, the testing is extensive. The testing is extensive as double-blind, placebo-controlled studies for safety. Phase 1, phase 2, phase 3. Anytime you add a drug to a protocol, you have to test each drug individually and then the combination. And it takes years. First is the safety trials where you do accelerated doses, things like that. You accelerate to the level of toxicity. Not a single study has been done in that regard for 36 years in the vaccine program with anything on the schedule. Things are added every year. The combination's not tested. And more important, the development, the manufacture of the vaccines. You might think if you're getting a shot, let's just take, for example, Pediarix, which has hepatitis B, diphtheria, tetanus, acellular pertussis, and IPV vaccines, the injectable polio vaccine. That's 6 antigens in a single shot. If you co-develop them together and you purify all the garbage, that could be a safe vaccine. But they're not purified together. They're manufactured individually and they're combined. So you add the toxins, you add the contaminants, and it's overwhelming. And that program that Bobby Kennedy referred to, the National Vaccine Injury Compensation Act, generated the compensation program. And for the last 5 years, Dr. Rossetti and I have served as expert witnesses showing how the vaccines cause the injuries that we're seeing in the susceptible children and in the susceptible elderly. Things like dying suddenly of cardiac arrest 24 hours after an influenza shot in an 80-year-old man. Well, the injuries that we see are the same injuries, the same alterations in gene expression, the same lack of antioxidant protection, the same mitochondrial dysfunction, the same cytokine storm. And those are what we write, and that's the way we write the reports. And we're called idiots because they said there's no evidence of that. These aren't systemic. They have local inflammation and nothing else. And yet then we see with COVID-19, what does the coronavirus cause? It causes mitochondrial dysfunction, a cytokine storm, a depletion of glutathione, oxidative stress, levels of ferritin, iron in the blood, that we're supposed to believe this coronavirus is causing that. And it's exactly what the vaccine injuries are in our experience over the 5 years. And that's why I say this is a big cover-up, because essentially nobody will be exposed in a natural way to the SARS-CoV-2, but many will be said to die of COVID-19 that had nothing to do with SARS-CoV-2 and everything to do with other environmental toxins and immune compromised people. And primarily those people have been given vaccines over the past decade, severely compromising their immune system.
So are the people dying now the ones that have those compromised immune systems because of the vaccines, as opposed to a virus that they're getting and transmitting?
Absolutely.
Okay. Is there a virus?
Yes, there's no question there's a virus. There's no question, that there's a virus there, and that's particularly the lab workers, the first responders, the people. We call it nosocomial transmission. It comes from the hospitals, from the doctors and nurses. In our first book, Plague, which we talked about, the chapter 8. Was an invitation-only meeting at the highest levels of the government. And there was an oh my God that said, you mean all those sequences we saw in the 80s were real? And then the big oh my God was, and the cover-up was, we can't afford to retrofit our lab Our labs. We can't make our labs safe as if you were working with HIV. It's called biosafety level 3. And so the lab workers were getting infected by contagious, that is airborne, spread through coughs and the same kind of thing, fluid, everything we're seeing in coronavirus, airborne cancer causing viruses. And the government's response was cover it up. I got infected. Many of my colleagues got infected, so as I've proposed, and I actually wrote to Bobby several weeks ago, and he asked me the question, "What do you think's going on?" I think it's SARS-CoV-2 plus XMRVs plus HIVs plus the many other adventitious agents in the vaccines, depending on the vaccines, the cow blood, the pig blood. Pigs have coronaviruses in the Rototech vaccines, I think, and then the 5G, which the frequency of that I believe it's 160 gigahertz, will actually separate hemoglobin from iron. That iron is released into the blood as ferritin. Ferritin levels over 3,000 will give you the exact same cytokine storm that is being attributed to SARS-CoV-2 infection. So we don't know, and they're not testing, and that's why the liberal diagnosis, so that all the injury can be covered up. And that is my hypothesis, and I can support it with a great deal of data, and every measure that the government is using essentially proves my point.
There's a lot of factors in there, and you definitely think 5G is one of them.
Correct. I have several colleagues who have a great deal of experience, and they do as well. As are things like uranium, plutonium, the waste, the things that we're seeing in our environment, very high levels of. I believe last August there was a spill in Russia that reached our coast somewhere around in California here around. So radiation, clearly radiation damage. Some of the injury very much looks like radiation damage, according to my clinician friends. So when you get in the airline travel, when you get in a plane and you get above 10,000 feet, then you're exposed to a lot of radiation because you're above the protective ozone layer. So airline travel doesn't necessarily make you more liable to get infection because of the people on the plane, but because of the energy, the EMF, the extreme EMF on these planes, and then the combination of the radiation. So that as you travel across the country, say in a plane, that you drive oxidative stress so that you deplete your intracellular glutathione, your protective mechanisms, and this drives infectious disease, not just of a coronavirus.
So is there an increase in deaths or just a reclassification of deaths?
There's a reclassification of deaths that we know of, in this country, I believe 2,000 people die a day of cancer. And those people are quite sick right now as they've been denied their treatments. So it's a reclassification of deaths, and the public is being misled.
So there's no net increase because of COVID-19, in your opinion?
No.
Okay.
No.
And this is being reclassified now and also being financially compensated for that reclassification because of this corruption behind the scenes that are intending to cover up what's been going on in vaccines over the past 40 years.
Correct.
Okay. Tell me about vaccines, because I'll be honest, doctor, I've been talking to people for the last 5 years that are very suspicious of vaccines. I have 2 young boys, 3 and 4 years old, that, thankfully now we never vaccinated, but I was really thinking about it 6 months ago. And again, I come from a classic science training and background where I'm taught science works, especially if it's tested. Vaccines are based in science. And so I just would trust the establishment. But it's so hard to believe that these toxic things are right out in the public, being injected into our children and being required for them that. And in the UK here, they have to have injections to go to school. How can this kind of open lie have grown so big without anyone saying something?
Well, I like you, I come from a classic background, and I believed I developed immune therapies and vaccines. I encouraged even my siblings to get the Gardasil vaccine for cervical, for HPV, to prevent theoretically cervical cancer. So until I experienced what I experienced in 2011, and since, with what was revealed when I actually saw the data, because most people don't see the data. We work in other fields. We make different kinds of immune therapies, and until I realized that none of the safety testing was done the way we discussed earlier, until I looked at what's called the excipient list, which is all the other stuff that's in the needle, that's not the antigen, that's not the thing you're supposed to make an immune response to. These, what the adventitious agents are, the microbes, and then aluminum, formaldehyde, polysorbate 80, which is a detergent that opens the blood-brain barrier. We use it in developing drugs for brain cancer because it's difficult to get things into the brain. But why are you injecting it into a newborn or the elderly or anybody else for that matter? Well, the fact of the matter is, because most people don't know about the 1986 National Vaccine Injury Compensation Act, where all liability was removed from manufacturers, and the government given the job, the HHS and the Department of Justice, DOJ, given the job of doing the testing, as at that time, President Reagan was told again by Tony Fauci that that vaccines are, I'm paraphrasing, unavoidably unsafe, and we're not going to make your vaccines and prevent these, pandemics if you don't relieve us of the lawsuits. Because in the early 80s, and it's in our book, Plague of Corruption, there's a chapter on this. In the early 80s, an environmental attorney, Mike Hugo, was winning a lot of lawsuits against DTP injuries, for DTP injuries in courts. The huge lawsuits, like we know in a few years ago with Monsanto and glyphosate and Roundup. These huge $100 million lawsuits, probably at the time it was less, for these DTP injured kids. So what is DTP? Well, it's diphtheria, tetanus, and pertussis. But they grew the pertussis, the agent, the microbe, in the cells. And literally, to tell your audience how they're made, they literally just took the cells, slammed them against the wall of a centrifuge to spin, to concentrate it, and then just didn't clean out the cell debris. Didn't clean out the cells that the agent was grown in, and that was causing extreme seizures, death, the debris, the garbage from animal cells. Literally just took it right out of the vat and injected it into people, and the cost of cleaning up, the cost of cleaning up the vaccine was like a half penny a dose. And the company at the time, Wyeth, and I encourage you to have on your show sometime Mike Hugo, because he taught me so much. I knew none of this in 2011 before he started educating me. He's the lawyer that was working on these, and he actually wrote the parts of the law for the vaccine injury compensation program, because what they were doing in these cases was dragging it out for years, and the families just really needed relief for their severely injured children in wheelchairs and needed to get them some care. So this was supposed to be a rapid 1 year, we'll compensate here, we accept that the vaccines cause injuries. And the court has been so corrupted since then, to the point in 2011, it's totally corrupt, and essentially the vaccine is presumed innocent at all costs. And you're suing HHS, the entire Health and Human Services and Department of Justice, as the injured. And I, as I said in my book, with everything I've been through with in in the past few years. The worst corruption, the most horrific thing I've ever seen was vaccine court, and it's pure evil.
And there's a lot of money involved here, I'm guessing. And we see figures like Bill Gates and Dr. Fauci telling us that the only solution is a vaccine. You want to get back to work, you want to maybe not lose your generational wealth or any of your savings, it's vaccine. You want to go back to gatherings, it's a vaccine. It's almost like that is being quoted as the only answer, and the public is almost running towards this as a solution. How are they involved, and is it purely financial, the interests of these men and other people in the corruption?
Well, it's considerably financial, but again, this is criminal extortion. This is, they know they're not safe. They know there won't be infected. We all know the data show that we haven't developed a vaccine for SARS in 20 years that does anything other than drive the disease and will kill people. And yet, the public officials, Dr. Fauci, Deborah Birx, Robert Redfield, all have not only financial conflicts of interest with the Gates Foundation and other things, but they're covering up criminal extortion and criminal fraud in publications all the way back to the 80s, and the criminal fraud they perpetrated with a vaccine for HIV and drugs for HIV back in the 80s. So they really should be charged with treason for this latest. All I can say is it's a plague of corruption, and it's a big cover up, and it's crimes against humanity. I don't know any other way to say it, but.
And now they're trying to rush it through. They got the team in Oxford here, putting their injections into rhesus monkeys, and now they're trying to push everybody. It might be ready in 6 months, which is faster than I've been told any other vaccine has been ready, and really like pushing it towards people. Again, talking to Bobby Kennedy, he's like, Brian, even if there was something that's successful, it's such a low percentage. It's not a fix-all. It's just, this is all a dream, a lie. This is not even a possible solution for us.
And why would you give a vaccine to people who already have an antibody, who've already been exposed, have developed a natural immunoglobulin G for a past infection, or IgM, the mucosal surfaces, for a recent or current infections? Why would you give a healthy person a shot that could drive the toxicity, as the data have shown, when they're already immune? Why aren't the immune, why aren't the exposed, who are not sick, healthy people out there working to protect the compromised? And why aren't we protecting the compromised with the therapeutics that we know work, like hydroxychloroquine and the type 1 interferons and vitamin C's and zincs, the natural products to protect them? Why are we holding everybody in? That's why I call it criminal extortion. And they don't get out of their house, and they're driving further and further into their own depression or anxiety or disease. They can see the effect it's having on the family when they can't pay their bills. The children who aren't educated. This is, finally it's like, oh, how bad could it be? And you get that shot. And once you do that, you can't take it. It's very difficult to detox this stuff. So again, it's, why would you do it if 0.1% to 0.3% are the only people you're protecting, and that immunity might already be here? Isn't that the heart of vaccination program? Every vaccine, if in the FDA, if you develop an antibody, and again, most haven't even been tested to do that, and we know most don't. So if you get an antibody and you make a vaccine, and the manufacturer shows it produces antibodies in monkeys, then by definition it passes, regardless of whether it's safe. So why doesn't a natural infection, where we've developed immunity and people have the antibodies they need to be protected from death? Most people don't realize the vaccines do not prevent infection. You're injecting the blueprint. You're injecting the blueprint of the virus and letting a compromised system try to deal with it. And worse, it doesn't go in the cells that a natural infection would, that have lock and key receptors, gatekeepers, so that only certain cells can be infected, like the upper respiratory tract for a coronavirus. Now you're making it in a nanoparticle, which means it can go in every cell without that receptor. So can you imagine the damage of bypassing God's natural immunity and allowing the blueprint for coronavirus that also has components of HIV in some strains, meaning you can infect your white blood cells. So now you're going to inject an agent into every cell of the body. I just can't even imagine a recipe for anything other than what I would consider mass murder on a scale where 50 million people will die in America from the vaccine.
15 million.
50
50.
million. Yeah.
Wow, that's a big prediction.
Yeah. But the numbers of the XMRVs and the vaccine injuries for the 40 years support that.
And now you have, people like Gates talking about these, tattoos, these like proof of vaccinations in order to rejoin the public and get on planes and go to public gatherings and go back to the workplace to make sure that it's mandatory for everyone. I mean, Judy, what should someone watching this right now do with this information? Should we just say no to vaccines? Should we start asking more questions? I mean, what do we do?
I think we need to go to our local, our state, and our federal officials, and we should say no to any mandates that take away our constitutional freedoms. I think we should say no to any health measures that violate. In fact, the masks violate the ADA, Americans with Disability Act, and HIPAA laws. So for every grocery store that keeps you out if you don't have a mask on, they could be fined by the American for Disabilities Act because you can't ask what their lung infection is. If I go into a grocery store with my cough, nobody can ask. So I believe every American needs to take back, and people worldwide take back their rights and say no and demand that their government officials obey the Constitution. And if they don't, a law that is unconstitutional, I'll paraphrase Thomas Jefferson, is not only one that should not be obeyed, but where literally civil disobedience should occur, where they should be protesting. We should be out in the street hugging. Nobody elected Bill Gates. He's not a medical professional. Nobody elected Tony Fauci, and none of these people should be removing our constitutional freedoms. There's just, what do I say? I say what I say and do every day. I leave my house. I go out with my husband. The worst thing about COVID-19 is I'm not much of a hugger, and now in public I pretty much have to hug everybody. So to show them that you won't get sick, hugging your child will not make you sick. And this is what we have to do. And I've encouraged my friends. One of our Christian Bible studies, I'll shout out to them because we had a nice little birthday party in San Diego where we hugged and took pictures and posted it, and enjoying birthday cakes and kissing and celebrating our friends and being together again. And that is, we speak the truth in love, but we're not going to be denied our freedoms, that freedom of choice of what goes into our bodies. And since none of it's been tested and none of it's been proven or shown safe, and they have not adequately disclosed what's in that needle to everyone, then nobody need obey those laws. And we need to go back and take back our public beaches that don't belong to Bill Gates or Tony Fauci.
Doctor, can you explain to me how someone like Dr. Fauci or someone like Bill Gates, who are there to, they're technically there to protect the public good, can also have patents on some of these vaccines or even viruses. It seems like a massive conflict of interest to me that could be the case. And yet, when I read it, it seems to be the case.
It is the case, and that changed in the early 80s with something called the Bayh-Dole Act, Bayhdole. This was the senator from Utah at the time, and Bob Dole, I believe he was in Virginia at the time. But in the 80s, that act gave government workers and university people who were supported with taxpayer grants the opportunity to patent their work.
To continue watching the rest of the episode for free, visit our website londonreal.tv or click the link in the description below.